control. Traditionally, we've been giving bed nets, both through the mass campaigns, but also through the antenatal and clinics for the little ones, the immunization clinics. More recently, we are giving bed nets through schools. The aim is to make sure that everybody in the household is able to sleep under a net every night. So we are going beyond giving nets and emphasizing use. We noted that in our communities, as much as the nets are out there, people don't use them, people sell them, and that has caused a break in our vector control. So we have launched a serious campaign on use, emphasizing they should put the net up every night, they should care for the net appropriately, not hang it in the sun, not wash it with heavy detergents. If it has a hole, repair it, and where possible, they should be able to purchase nets on their own. We have indoor residual spray as another vector control tool. We are also encouraging environmental management. It's not enough to wait for the government to do the spraying and to do the bed nets. The communities now need to wake up and look at the environment around them, so that together we can make sure that we are ridding our communities of malaria vectors. Under case management, we have the test and treat at the facilities. This is something the community is aware of. Early seeking of care, but with emphasis on getting care after having a diagnosis. We've rolled out some new interventions that I'd like to talk about. One of them is called seasonal malaria chemo prevention, and this one we rolled out in Karamoja region. I already mentioned that Karamoja region has a very high burden, but it also has an important context. We find the community is mobile. Some of the other interventions are not very easy to deploy, like the indoor residual spraying, the bed nets. The communities may sleep outside or the house is really small. So we've targeted this population, which also has a very seasonal picture. Their malaria peaks between the months of May to September. So what we are doing, we are targeting the most vulnerable. These are children under 5. With a prevention measure. We give them medicines once a month for 5 months, and this has been shown to protect the districts where this has been implemented. It's implemented in 8 out of 9, and you find that 95% of the children have been protected from malaria during this high season. The government is also poised to introduce the malaria vaccine alongside with other sub-Saharan countries. We are planning to introduce this in 2024. Arrangements are underway. We've developed a plan, and we've also had to target our deployment of the vaccine just as we do the other interventions, and really look at who is hardest hit, who is in most need. Important to notice the vaccine doesn't prevent malaria, but when a child who has been vaccinated encounters malaria, their body is primed for the fight. So they will not come down with the severe forms that lead to death, lead to severe anemia, convulsions, kidney failure. So we call upon the public to embrace this vaccine and move with us to save our children. We will start with districts where we have a very high burden and where we've also had a lot of children dying from malaria. Unfortunately, the global capacity for malaria vaccine production stands at 15 million. And there are several countries that require this. So we will receive 1 million doses for 2023 and deploy these, 2024 and deploy these, and then we will also continue in 25 and 26. And this is for the RTSS. The global community has also come together to develop another one, R21, that gives more promise. It's easier to produce, and we expect there will be more doses. So we will be alert and definitely will make a pitch for that vaccine to increase coverage.
Safety?
The vaccines are safe. Vaccines have been used for many years. There is a lot of vaccine hesitancy in our communities, but it's important to note that we have so many immunizable diseases. We have diphtheria, we have tetanus, we have polio, we have hepatitis B, we have measles, all of those childhood diseases, and more recently the Haemophilus influenza. Now it's going to be very important for us to work together as public health, as media, as community leaders, all the leaders out there to address the community concerns on vaccines, realizing that vaccines, yes, are safe. These have been studied in clinical trials and they have been found proven to be safe, and we do test them before we administer them to the populations.